Hello, Ed. We are all set here. Handing it over to you right away. We can start.
My name is Ed Davies. Can you hear me?
Yes, yes. Yeah, Ed.
Okay. My name is Ed Davies. I'm a journalist at Reuters and president of the JFCC. I'd like to welcome you all here today for a Q&A session with Professor Wiku Adisasmito, who is the spokesman for the COVID-19 task force. And we really appreciate him coming back to speak to us again today in what is clearly a very, very busy time for him. We've had quite a large number of questions submitted in on different topics, so I hope we didn't keep you up at night last night, Professor. But given I know that you have a fairly short time with us, I'd like to see if we could start on the questions. Now, I think you've categorized maybe some of the areas of the questions, which obviously some of them covered the same ground. So if you'd like me to go through the questions, or do you have them there, Professor?
Thank you, Mr. Ed Davis from GFCC. I think I can read the questions and respond to the questions that some of the things that I will respond.
Okay, great. I mean, I know we had a sort of number of questions on vaccines, a number on testing and yes, transparency, and on medical workers in the healthcare system, for example. So perhaps I can allow you to kick it off on an area you'd like to answer. You could start answering some of the questions.
Yes, please.
Yes.
Prof.
Okay. Thank you. First, I would like to thank all of the international journalists and also the media from the international that have posed questions to us. And I think this is a good opportunity for us to really exchange information and data about how Indonesia respond to COVID-19 outbreaks or pandemics in the world. And first, I would like to respond to the questions that has been posed by Natalia from the Australian Financial Review. There are three questions. First is, how exactly is the Indonesia vaccine agreement with China? Is there a set price for the vaccine? And then second is, how is the development of the Merah Putih vaccine? Why isn't it on the WHO list? And then the third is, how do you respond to WHO statement that COVID-19 will be finished in 2 years? So first, I would like to say that the protections for the Indonesia people will really immediately become the government priority in COVID-19 mitigation to create a healthy and safe Indonesia. So I think this has been set by the government as our priority. And the Indonesian government has received commitments for access to vaccine candidates from several companies and through the bilateral agreements. And Indonesia has been able to secure a commitment of 290 million doses of vaccines from Sinovac and Sinopharm. And every vaccine development process needs to follow a clinical trial process until it has a distribution license. And vaccinations will be carried out when the clinical trials have been completed and get the good results. So we want to assure the public that once we implement the vaccinations, all of the vaccines have to be past the clinical trials and also have received the good results. While the production capacity has been prepared and clinical trials of one vaccine candidate and the development of the healing therapies and the development of the Merah Putih vaccines are running as a national effort towards national independence in vaccines. We know that Merah Putih vaccine has not been listed under the WHO because still in the development right now, in the preclinical phase right now. Once entered into the first phase clinical trials, of course, it will be registered or recorded by the WHO. The overseas cooperation efforts related to vaccines, first is with the Biopharma and Sinovac are currently conducting clinical trials in the third phase of the corona vaccines candidate. And then also Sinopharm, the phase 3 clinical trials was carried out by the China National Biotech Group, or CNBG, Sinopharm. The test was conducted in alliance with the United Arab Emirates and the Abu Dhabi-based company called G42 Healthcare. Sinopharm selected the UAE for its phase 3 clinical trial in 85 out of 200 existing nationalities. And then also the other efforts, the Kalbe Pharma and Genexin from South Korea are working with the South Korean biotechnology company called Genexin to develop GX19 vaccine, and will conduct the phase 2 clinical trials later this year. And the government really is open and continues to very proactive in cooperating with various countries and companies, including AstraZeneca from the UK, to make sure that we have the access of vaccines to protect the Indonesian community. And I want to make sure that the government objectives is very clear, fast and prompt response and protections for all Indonesians to create a healthy and safe Indonesia from COVID-19. And then
Thank you.
Questions about testing from Edward Davis, Reuters News. Statistics from Our World in Data, a non-profit research project based at the University of Oxford, show Indonesia ranked 83rd out of 86 countries surveyed for overall test per capita. Why can't Indonesia increase the amount of testing it conducts? What do you see as the ideal level of testing for the country, particularly with tourism and more parts of the economies set to open up? This is also questions that similar. I'd like to answer the questions that are similar. The second question is from Richard Paddock at the at the New York Times. You have said that Indonesia positivity rate is too high and that the number of tests being administered is too low. What is the government doing to address this? And then from Pak Wahyudi Suryatmaja, the Straits Times, what is the plan to increase Indonesia very low testing capacity, and how would you explain your current testing strategy? We understand we have very much only been doing, first is diagnostic testing, second is testing for contact tracing, while lacking on surveillance testing, which involve testing a lot of asymptomatic persons to ensure we prevent those populations most at risk for adverse outcome from contracting the virus. So we know that the president has been targeting the test capacity up to 30,000 per day. In fact, we are still on pace to reach the target consistently. And in the early August, one day we have reached the total of 30,565. And during the day of, or the week of 10 to 24th of August, the average testing per day was 24,000. So I have to say that this is a challenge to us, the government of Indonesia, to make sure that the number of the testings has to be increased, and the number of the people testing as targeted by the WHO has also has to be increased. And at this moment, Indonesia has 320 laboratories with PCR machines and machines that can support the testing. And of course, with the number of the institutions manage these laboratories are varied. We have 12 ministries and institutions where the laboratories are originated. And this is a challenge to really manage under one command. So that's why over the weeks and months, we improve the coordinations among laboratories to make sure that the number of the testing of each lab can be optimized, improved, and then the distributions of the laboratories or samples from the healthcare facilities are also distributed accordingly to the capacity of each laboratory. So this has been worked out, and the improvement from one laboratories to others are varied as well. It depends on the situations in the area and the human resources, and then also on the time in terms of working time, to make sure that the burden are not too high, because it's very dangerous for the laboratory personnel to work over the time because of the they are handling the infectious agents. And then we have been announced to the public through the media, to the national media, that we understand that the WHO standard for testing is 1 per 1,000 populations per week. And Indonesia, with the 260 million people, we need to make sure that we have the 267,700 tests or patients per week. And overall, Indonesia has reached 35.6% from the WHO standard nationally. And the number of the testing has been increased from time to time, although we are still struggling to make sure that we can reach the WHO standards. And there are some areas in Indonesia that has reached the WHO standard, like Jakarta, South Sulawesi, and other provinces. For example, Jakarta has reached 4 times of the standards of the WHO. And of course, why this city has that capacity? Because of the facilities, the laboratories, the number of the laboratories and PCR machines in Jakarta are a lot compared to others. And then they are doing active case findings. So therefore, they got more samples, and they have the positivity rate as well in Jakarta is lower compared to other part of Indonesia, although they still have other challenges as well. So I have to say that the challenge of the situations in terms of the geographic situations in Indonesia hindered us to really quickly improve the testing in terms of that they have to send. It takes time to really send samples from the remote areas in Indonesia, but most in the big cities, the capacity laboratories in that area has been fulfilled. Okay.
Could I just interrupt for one quickly, Pat? Just a question on, today we had a second record daily rise in cases. I just wondered, and I think it was 18% of those tested were positive, which is quite high. I just wondered, are you concerned about this, or what? How can we contain this?
Yes. the number of the testing every day is varied, as you observe. And there are several factors contributing to this challenge. And one of the last challenge that I haven't explained to you is the reporting system. So imagine if Indonesia has the IT system, so that the reporting system or connections of all laboratories in Indonesia into one system, so that it will enable the laboratories to really report directly and can be recorded at the central level, whether it's the central at the national or at the provincial level. And we are improving the IT and data management system to make sure that interoperability of the data management system can be achieved very soon. The system is there, but we need to make sure that we have to train them and to exercise, make sure that when they are reporting to the system are in compliance with the training that we have been given. And also we have to cross-check with the data that they have and also the data that the national system recorded. So that are the opportunity for the future to improve the capacity of the laboratory. Okay, and then I think this is also similar questions from Reuters, New York Times, Straits Times, and Arab News. I think I have addressed that. And then okay, and then questions from Khairul Asman bin Rahmat, Embassy of the Republic of Singapore in Jakarta. It appears as if the government focus from the public health perspective is now on securing the vaccine and forging partnerships with other countries for vaccine development. A lot of time and resources have been devoted to it, and this is very apparent in the public speeches by the government officials. Does it mean that increasing the testing capacity in Indonesia is no longer the priority, despite the low testing rates? Indonesia testing rate has shown some improvement, but it is still far below the WHO standard, and the positivity rate at the national level is above 10%. Even in Jakarta, the positivity rate has reached close to 10%. Okay, I'd like to respond to this issue that all of the countries in the world are in a race, I would say, to get access to the vaccine, including Indonesia. And we try to get the access because we have a big population in Indonesia, and we want to make sure that the vaccines have been developed in various parts of the world are accessible for the Indonesian public. So that's why our government is very active, approaching several countries and institutions to get the access. But in the same time, we know, everybody in the world, that the vaccine is not necessarily the only answer to end the pandemic. We understand the preventive measures are the best approach to really fight with this with the virus. So therefore, the public health approach that has been implemented in Indonesia, behavior change campaign that now has been very, we call it, one of the main programs that we are having right now. We want to make sure that within months before we get the vaccines, the behavior change may prevent the public to be infected by the virus. So that's why it is not true that we will not do any public health measures because we are expecting to get the vaccines. So because no one in the world right now has been showing that the vaccine is the solutions. And even the previous questions posed about whether the WHO predict that this issue of the pandemic will end in 2 years. No one knows. So that's why we have to make sure that all parties in the world working together, and being a big country in Indonesia, we assure that our monitoring on the performance of the how we handled the testing, the tracing, etc., are treated per province, per district, and cities. Okay. I think this is similar questions about data. First from Richard Paddock at the New York Times. Some independent health experts estimate that the actual number of cases is 5 to 10 times higher than the reported number of cases. Do you agree? What is your estimate, the actual number of cases? Okay, I will respond this first, but then I will continue with the follow-up questions from Tom Allert from Reuters. I have to say that I disagree with this estimate, because we are working, I'm working with the data that we are collecting from all parts of the country, and all reports have been transparent and monitored by the public, by the media, the national media, either local or national. So we believe that the data that we have are true, although some improvements can be made in terms of reporting, and when some duplicates, we still improving in terms of making sure that we have the true data. And with this type of estimations, I don't know, these experts use the formula or theory, but rather than looking at the worrying numbers that estimated by the scientists, we prefer to really improve the data that we have, and we routinely, weekly, we report, to the public, at least, to the national media. And of course, this is a good sessions that we can expose to you in terms of the data that we have. And we make the zonation based on the criteria, the public health criteria as recommended by the WHO. We have 15 indicators, which is based on the epidemiology, public health surveillance, and the healthcare facilities. So using that indicators, we collect the data from all over Indonesia, from districts and also cities, and we report independently in each for the independent districts and cities. So that's why I personally convinced that the data are true, although there are some improvements that need to be made, not only in the remote areas, but also in the big cities. And then Tom Allert, Reuters, President Joko Widodo and yourself have assured Indonesians and the media that the government will be fully transparent in its handling of COVID-19 pandemics. The centerpiece of this commitment was the Bersatu Lawan COVID-19 portal, but much of the information collected by this portal and the government is not disclosed to the public, epidemiologists, and even some government officials involved in the COVID-19 response, including hospital reports of death of persons with COVID-19 symptoms and provincial and district testing data. Can you please explain why this commitment to data transparency has not been met? Okay, again, everybody can access the data to our portal, covid19.go.id/peta risiko, and also the peta sebaran, that you can see the risk of the area, as I mentioned, based on the parameters or the indicators that we developed. All are based on the data. and we calculate, we make the scoring based on the available data. And we have been using this to manage the area, and all of the governors, the bupatis, and also the mayors use these zonations to really respond and improve what their performance every week. And in terms of the data, the BLC, Bersatu Lawan COVID, is really a data integrator where the data comes from the Ministry of Health, where the Ministry of Health receives the data from all of the health facilities, laboratories, and also contact tracings that have been conducted by the local governments, namely the district health offices. So therefore, what we are showing is what we have. So there is no indications at all, at least from my side, that we are protecting the data and not reporting to the public. But we want to report the data that has a good quality and can be responsibly argued. And I hope also the public, any media, scientist, if you raise the issue about Indonesian data in transparency, please show the source of the data and how you collect the data, because we want to make sure that the data are really, and the information is really our navigations to control the disease in Indonesia. Next questions also, it's from Richard Paddock at the New York Times. In Bali, the case numbers declined in early August, but after Bali reopened to domestic tourists, the number began rising again. Was reopening Bali to tourism premature? What should be done to limit the spread there? As one of the regions that play important part in tourism, Bali is fully aware that the stages they need to complete before reopening the domestic tourist. Last week, we had conversations with all of the officials, including the governor of Bali, to review on their performance. And we see that their cumulative number of cases in Bali is still far lower than the national number. The percentage of the death in Bali is still one of the lowest number, which is 1.15%, and the national figure is 4.2, where the global figure is 3.4. So we understand at national level, our mortality is still higher than the global. However, for Bali, it's much lower than the global, and this is the real data. And the percentage of the recovery in Bali is one of the highest number, which is 87.59% among other provinces in Indonesia. Whereas at the national level, the recovery percentage is 72%. So Bali is higher than national figure. And at global level, the recovery is 69%. Again, Bali has performed well in terms of managing the case, and this is the modality for Bali government to open the tourism once they are assured themselves that over the time they can manage the situations. So again, this is a good news because Bali will be an example for other countries how they manage. Even the task force, before the task force at the national level has been formed, Bali has formed their own task force for COVID-19. And even they closed down all of the local culture games like Sabung Ayam, because it potentially creates crowds over there. And the villages that they have, the Pacalang, and also the culture that they have embedded in the village has been very active in contact tracing, in making sure that the behavior of the people are improved, towards COVID-19. Okay. The questions about economic view. It's from Pak Wahyudi Suryatmaja, the Straits Times. How significant does the lower class economy contribute to the current 37,800 COVID-19 patients? It would give a huge challenge if the coronavirus has spread to the undeserved urban populations who live in cramped communities or in poor conditions that facilitate transmissions. We haven't been able to publish the analysis of the economic class of COVID-19 patients, but from the start of the pandemic, the government has put focus on vulnerable groups and COVID-19 medical charges being paid fully by the government, and the government has also distributed aid for social assistance in the form of cash and subsidies. And we understand that the cramped communities may have high risk of transmission. And that's why in Jakarta, for example, the Public Health Office held an active case findings and to detect cases in high-risk areas. And even they can report clusters in various different groups, like in the residential areas, in the offices, in the markets, as well as at the masjids and other culture activities. And I think with this type of reporting systems, really to make the public aware that they have to really control their social activities because they are still in the PSBB, and this is alarming for all of the Jakarta populations or in the dense area, to make sure that they can control the disease. So that's why we want to make sure as well that the situation is controllable. And then questions from Desak Putu Sinta Suryani, Embassy of Switzerland in Indonesia. At an ASEAN event on post-COVID recovery, several panelists said there was no trade-off between health and the economy. No economic recovery without having first solved the health issue. How do you see that? So the sole mission of the committee, which is the Committee for COVID-19 Mitigation and Economic Recovery, or KPC PAN, is to balance the gas pedal and the brake pedal in the right amount, as mentioned by the President. So it means there is no trade-off in between health and economy. In order to have safe social and economic activities, careful steps are being taken by the government, and the central government and regions has attached to pressing the local transmissions. Why we say that? Because we have the approach using the data that I have been mentioned through the Bersatu Lawan COVID, where we make the zonation and we improve every week, where all of the local governments look at this dashboard as to measure how their performance within the past week. This is really our navigations when we want to open a social or economic or cultural activities in certain regions, areas, districts, and cities. They have to look at the zonations, and then they have to make sure that the government has mentioned through the President, before open the activities, they have to make the precondition. So they have to follow the steps. First is the preconditions. The second is timing. The third is priority. The fourth is coordinations between central task force or government with the local task force or local governments. And the fifth is the monitoring and evaluations. One of the examples, if they want to open for example, like market. They have to make sure that all of the studies are being conducted in that specific districts or cities, and all of the healthcare facilities are sufficient to support when they want to open the facilities, and if the cases increase. And at the same time also they have to make a simulation so that when the transportations bring the people to the office or to the markets and return home, we want to make sure that the physical distancing applied in all course of those opening of the activities. And by doing that, and with the consultations of with the local and central governments, we want to make sure that if they need support, then we can support. And the same thing, when we feel, the central government feels that they can open and responsibly manage the situations, then they can open the activity carefully. And when something happened, through the monitoring and evaluations, of course, we can stop the activities when needed, as recommended also by various parties. So I think that our response to the questions from the Embassy of Switzerland in Indonesia. And then I think, yeah, this is the last questions.
If you would like to elaborate just briefly on testing, you mentioned about the geographical challenges and constraints to ramp up testing. Testing is an important component to fight coronavirus. So are you suggesting we should be more careful in reopening or in lifting restrictions because of these constraints? Because we understand as the social contact increase, testing must also be increased.
Yes. When we open an area, when an area propose to open an activity like social, economic, or cultural activities, we always ask them to prove that their testing sufficient enough, and then the performance in terms of the number of the cases that they can suppress has been shown. Otherwise, it will improve the risk of uncontrollable situations. So that's why, while we are also improving in terms of the number of the laboratories, obviously it's sufficient. If you divide the target of the testing per laboratories or in all over Indonesia, and with the number of the laboratories are sufficient. But because of undistributed samples sent to the laboratories, that's why some of the delays in reporting and testing still occur. And we need to make sure that all of the laboratories at the local level improve that type of collaborations between laboratories and the local authorities over there.
Are we engaging private sector to help do testing? Have we started doing that?
Yes, some of the private sectors or private laboratories are also involved, and it can be improved in the future, their involvement. Yeah.
Okay, so by end of this year, we may say we can boost testing to about 30,000, 40,000 per day. Are you confident?
I'm very confident. By the end of the year, 30 to 40,000 tests per day can be reached. Yes, it can be reached. I thought that you were going to ask like next month, but for the end of the year, yeah, it can be achieved. I think there is one questions from, this is about the recovery from Kevin Rourke from Reformasi Weekly. Total active cases nationwide are declining by 6% week on week as of 26 August. Is this due to the speedier recoveries? If so, why? Are treatments such as steroids and antivirals now widely used? I have to say that the quality improvement of the healthcare, responsive testing to detect the symptoms, the high discovery of the comorbid for each patient. One of the examples is in Central Java by the governor. It's very active in looking for the comorbid of the patients, and standardized treatments has been contributing to the improvement of this treatment overall. And I think by the time we need to improve as well, so that it applies all over Indonesia, so that the situations will be better.
Thank you, Prof. Wiku. I've been alerted to close the session unless Ed has one final question. We can do very quickly. Otherwise, we can stop here. I give it to Prof. Wiku.
I think one of the important thing with this discussions is that I want to make sure that we encourage the media to confirm and report articles, truthfully, since we are striving towards data transparency, and the media are our friends to really work together, not only in Indonesia but also for these regions and also the world, because if we are together, I think we are sure that we can fight for this COVID-19. So thank you.
Thank you, Prof. Wiku, for the okay. Thank you, everyone. We can end here.
Okay.
Hope we can do this regularly with Prof. Wiku.
Sure. Yes.
Okay. Thank you.
Okay. Thank you very much. Bye-bye.